Nothing.
Just a little more. Okay. Good afternoon, all. I am Joanna Kendick, a member and volunteer with Capitol Hill Village, and Samantha Henson, a staff member, is with me. And I believe that all of us in Capitol Hill Village are generally aware of the disparities in our societies and our city. And as many of you here know, for over a year now, we've been learning in more depth about the impacts these societal issues have on our Black and Brown neighbors. And in spring, we learned more about food deserts and how growing fresh greens helps many of those living in the city. And we learned of many local not-for-profit organizations engaged in helping their neighbors. But only recently I learned about DC Greens. I learned about it by attending virtually, as we all do now, SAC meeting, SAC Senior Advisory Coalition. And there I heard Ms. Huston talk with clarity and passion, definitely passion, about No Senior Hungry Bill. It was great. And we are fortunate to have her with us today. As I learned about DC Greens, I found it's a fairly young organization, started, I believe, in 2009 by two neighbors in Glover Park neighborhood. And I highly recommend you look at their website and learn more about all they're doing. And there is a lot of powerful language summarizing many issues we've been learning and talking about. And here I've pulled a few quotes. Their vision is a city in which health equity is a central value, healthy food is a human right, and all residents have the resources to shape and control policies and programs for their own communities. Wow. Their mission is advancing health equity by building a just and resilient food system. And DC Greens, they propose to advance those health equity by focusing on transformational changes at the system level, building bridges. Note, building bridges between government, private sector, communities, and nonprofits. Developing advocacy channels to amplify marginalized voices. Curating best practices and leveraging existing infrastructure. Stress again, leveraging existing infrastructure. Then responding to community needs, providing thoughtful leadership. This is all fantastic. So now I turn the microphone over, or turn the screen over to Winnie Huston, Food Policy Strategist with DC Greens. And she will tell us about important legislation recently proposed by our council members. We've already been hearing and spreading word about it among ourselves to some degree, but we'll hear in more detail about it. This bill advances, again, transformational changes at system levels and facilitates building bridges that I think we'll agree are very important and very much the issues that are part of the DC Greens mission. So Winnie, over to you.
Thank you, Joanna. Hi, everyone. Good afternoon. It is a beautiful day and or beginning of a beautiful evening, and I'm thrilled to be here talking with you. I want to just give you just a little bit about this legislation. I'll talk a little bit about myself, a little bit about DC Greens, and then have a call to action, because I think that we, as residents of this town, people who care about inequity, there is room for us to be a part of a change. I started working for DC Greens a little over 4 years ago. I was retired, had been sitting on my butt for about 12 years. I retired early and my health started to fail. And when I finally went to the doctor, I was 61 at the time, and the first thing out of my doctor's mouth, it was a female doctor, was, I'm going to put you on meds. You know, I was having all kinds of issues. And so I was like, no, let's talk about other things. And I was living in a part of town that I had access to all the food that I could possibly want, all the healthy, nutritious food. I had transportation options. I had farmers markets. I had nutrition counseling at the local giant food store. So that was my first stop, is like make an appointment with an in-store free nutritionist. I ultimately opted for private nutrition counseling because I needed a little more help. The long and the short of it is, I am now 66. I still am not on any medication. I have a lot of energy on most days. I was able to, reduce the blood pressure, the cholesterol, the body mass index issues that my doctor was so concerned about, primarily because of where I lived in the city. I lived in a relatively safe part of town where I felt comfortable getting up at 5:30 in the morning and taking an hour walk. As I said before, I had access to many fresh food options, including farmers markets. Transportation systems were great, so that if I needed to get from one place to another, there was no problem. And so as I said, I was retired, and I realized that I needed to re-engage. There were so many people who look exactly like me, who were my age, and were living in a different part of DC without the access to what I had access to, would have been on medication. Wouldn't even have been able to find a doctor who was, willing to work with them. Certainly not be able to find free nutrition counseling, because that's very rare. Particularly when, as Joanna talked about or alluded to, the disparities in grocery access. In Ward 8, and you probably have heard this, there's one giant grocery store. There's just been opened a smaller footprint grocery store, a good food market. In Ward 7, there are 2 Safeways. And again, there's a couple of, there's some corner stores that are doing some healthy food options. But you look at Ward 3, there are probably 14 or 15 various types of food access options. Ward 1, where I was living at the time, Ward 4, where I'm living now, I am at the nexus of, I have a Safeway that's very close. There's farmers markets. There's a food co-op. And if necessary, I'm right on the Maryland line. I can hop, into Tacoma Park, Maryland, and have, options. So I've been very fortunate. Even when I was living, or when I first came to DC, I was living in Brookland in Ward 5. Still options. So my interest in equity, my interest in the issues that impact seniors, particularly those who are food insecure or who have lack of access, is personal, because it could be me. People who look exactly like me, are struggling every day. So enough about me. Let's talk about the No Senior Hungry Omnibus Amendment Act of 2021. That's a whole lot of words to basically say, this is a legislation that says we are going to stop the tide. We will not have hungry seniors in the District of Columbia. As some of you know, DC has been leading the nation in food insecurity for some time. We have not, in fact, when I first got involved about 4 years ago, I think we were ranked number 7. If DC were a state, we would have been ranked 7th in the country for food insecurity. We are now number 1. That means that there are probably 12,000 seniors in DC who lack consistent access to nutritious food. That's food that allows them to live a healthy, active lifestyle. We also know that seniors have higher rates of food insecurity for many reasons. Fixed incomes, heightened barriers to accessing food, whether it's transportation or mobility questions. And for some seniors, we tend to isolate. We tend to look inward, whether it's because of lack of family or for health, because of health reasons. And we also know that lack of good, nutritious food for a senior, the impact of that can be devastating because it leads to more chronic disease. So Samantha, can we run the PowerPoint so that people can, because I will say to folks, I am very informal in my discussion style. I want to be able to have a discussion with folks, but I did put together a PowerPoint so that if for folks who want to read along or who want access to more information, you can absolutely have access to this. As I said, this No Senior Hungry legislation, it was introduced in October. Councilmember Che convened a working group of government officials, nonprofit leaders, community folk, seniors themselves, to look at the issue of senior food insecurity, to see if we couldn't put our arms around what some of the issues were. What services are out there? What kinds of things, what kinds of improvements could we get to? So she got 7 of her colleagues to co-introduce this piece of legislation, and it was referred to Anita Bonds' committee on housing and executive administration. We'll talk more about what that means and talk more about what the legislative process looks like. But let's talk a little bit about the lay of the land. And Samantha, you can advance the slide take to the next one. There are currently, there are 14 nutrition programs, and some aren't actually programs, they're more like opportunities. And some of those programs or opportunities are seasonal. Not all of them are focused solely on seniors. For example, in terms of seasonal programs, we've got the farmers market incentive programs. Some of you may be aware of Produce Plus or the senior farmers market nutrition programs, the senior checks. Those of you who frequent the farmers market, maybe at Eastern Market or at the various other farmers markets around the city, you may see folks with little checks that seniors particularly, that allow folks to purchase fruits and vegetables. But many of these programs are administered by government agencies, but there's very little communication between these programs, and there's no agency that is like really coordinating all of these efforts. So one of the things that we found during these working groups is that many seniors, particularly those seniors who are at risk, aren't aware of the available service or have difficulty accessing those services. And one of the reasons that people are unaware is that many of the programs do limited outreach. You've got various agencies that are doing good work, but only have funding for several hundred or possibly 1,000, or there could be several thousand people who could participate in a program, but you sort of have to know about it. And part of what we heard during the period of time that we were having these working groups is that folks don't want to set up expectations for seniors that there are resources out there, and because these programs often have limited funding, they don't want to set up the expectation and have seniors come and then they don't have enough. Please advance, Samantha. So through these working groups, we were, and as I said, we were looking at the lay of the land. What federal programs are there that are out that DC participates in to provide nutrition services? What kind of outreach and communication is done for seniors? What nutrition, healthcare services are available at a community level, at a neighborhood level? What kind of communication is there between these programs? Transportation, as I alluded to at the front end, is often a barrier, or the lack of transportation is often a barrier for many at-risk seniors. Either they're no longer driving, or they don't have a car, or the public transportation system doesn't serve them in the neighborhood that they live in. And also, I'll speak for myself as well. I don't get around as well as I used to. So sometimes it's a mobility question. So that even if the grocery store is relatively close, it may be difficult for some folks to get to. And also, we looked at data collection, and we're finding that many of our computer systems don't talk to each other. As a government providing services, we've got a bunch of different systems that we haven't yet integrated. Next slide, please. So after hearing about sort of the lay of the land as we know it, and what we were hearing from people who would come and give presentations, was that we've got these agencies, no one is in charge, no one is looking systemically at senior food insecurity, and we're not communicating as well as we might. So what the major provisions of this bill will do is that it will establish a lead agency. Someone will be in charge of the effort to address senior food insecurity. The Department of Aging and Community Development will be the lead. However, every other government agency that touches seniors' lives, the Department of Human Services that administers SNAP benefits, the Department of Healthcare Finance that administers the Medicaid program, the Office of the State Superintendent of Education that administers or coordinates the adult daycare programs, DC Health that is a conduit for many of the food and nutrition programs, whether it's Produce Plus or the senior check. No, I take it back. The senior checks are paid for through the Department of Health, but the Capital Area Food Bank is the program that administers those checks. And also there will be representatives in this task force from organizations that serve seniors, members of the nonprofit community who are doing advocacy work, who are helping seniors, whether it's through the SNAP process or it could be grand family programs. And the important piece is that there will be nutritionists. There must be nutritionists as part of this task force that's going to put its arms around senior food insecurity. And there will be seniors themselves who will be part of this group. And I've said this before, and I will repeat it as many times as people will listen. The beauty, this is not a perfect bill, but the beauty of this legislation is that it says we are putting a marker in the ground. We are going to figure out together, the government, non-government, seniors. We're going to figure out we're going to figure out the lay of the land. How many seniors are out there who are food insecure? Where are they? What services are they accessing? Do we have services that are duplicative? Are there services that we should opt out of because of the nutritional value of the food? I mean, there are issues that we as a city for profit and for the nonprofit community and government really need to grapple with in terms of providing nutritious food, ensuring that seniors have the food that they need. Now, part of the responsibility of this task force is to advise the mayor and the Department of Aging in community living. And the important piece of, advance the next slide, Samantha, please, is that it's going to develop a communication plan. One thing I mentioned earlier on, we don't know how many seniors are out there. We don't know exactly where they are. We don't know how people find out about the programs that they access. What we do know is sort of anecdotal. Well, I heard about it from my neighbor, or I happened to be at the hairdresser and I overheard something, or I happened to be downtown looking at something and I saw a flyer. So we have to figure out how do we communicate, what's the best way to communicate with the various types of seniors that are in town. Those seniors who are computer literate, those seniors who are part of social media, those seniors who can access and use online application processes, those seniors who are illiterate. That is something that we in the city don't talk about. The adult literacy rate in DC is staggering. So many people who are intelligent, they maintain jobs, they do everything that have meaningful and wonderful lives. But if you ask them, to fill out an application, or you ask them to read a lot of information and retain it and then do something with it in terms of filling out the it's an obstacle. So I'm sorry, I get excited because this legislation, it is a critical step that we are at in the city, and I am so excited about this opportunity. So let's go back to a provision of the legislation. It's going to require that the Department of Aging and Community Living coordinate its care model. It's got to screen seniors for food insecurity and malnutrition and provide appropriate referrals based on that screening. Now, you would think that that's seems seemingly very straightforward. And in some ways, I think the department is doing that. But because the Department of Aging and Community Living is centralizing its processes, changing how they do business, it is critical that as they centralize, that they coordinate and that their care model is will provide the best services for seniors, because there's only going to be a one-stop shop for seniors to get these kinds of nutrition services. Advance the slide, Samantha, please. This legislation will also require the Department of Human Services that administers SNAP to change its processes some with respect to seniors. Right now, fewer than half of the seniors who are eligible for SNAP, less than half of the people who are seniors who are eligible for SNAP apply. And you would say to yourself, well, it's one of those programs. It's a program that, to support people who are, at a point where they're struggling. Why wouldn't they apply? the application process is daunting. You have to provide a lot of information. Until very recently, there was, for those people who are who are computer literate, until recently, you had to go down to the office in person, stand in line for a long period of time, fill out these paper forms, sit on these very uncomfortable chairs for many hours, and then hopefully you'd be able to see someone and go through the process of enrolling for the benefits. Also, the maximum benefit for a single person is quite low. And so some people feel like it's a lot of work for a little benefit. And not all seniors know about that there is this benefit, that SNAP is available to them. So this legislation will require the Department of Human Services to adopt what's called the Elderly Senior Application Process. It's basically a simplified application form and process for seniors. It creates a standard medical deduction. It streamlines the process for, documenting your rent, utilities, and other costs. The fact of the matter is, if you're food insecure, if you are a senior who has limited resources, your income is not going to fluctuate very much. Your bank accounts and your I'm sorry, I'm blanking for a moment. Your resources are limited. So adopt the simplified form. Many states across the country have done this already. And I must say the Department of Human Services is looking at this and has been looking at this for some time. But this legislation will say you must do this and you must do it by a time certain. And perhaps one of the most important things that this legislation would require is it would require the department to allow case management of services for seniors by trusted nonprofits who are doing work for seniors. I won't name an agency, but let Winnie Huston's, nonprofit agency that works with seniors bundle, and vet the applications of a group of seniors. Submit those applications in a bundle through to the department on behalf of those seniors. Be able to track that application as it goes through the process. And if there is a problem, be able to identify that problem and then work with that senior to provide the additional information. Right now, we have a system where there is an online process, an application process. It is not, all the kinks, let's say, all the kinks have not been worked out. And so if up until very recently, if you were able to apply through this online portal, it was not an integrated computer system. There have been some changes to it so that the system is now integrated. They're still working out the kinks. But there are so many people in this town who are not computer literate, who don't know how to download information or upload information or into an application, make copies and do that. So there are going to be many seniors who still will need to have someone help them with that application process, either do it online for them or to help them do it by hand. Also, again, we've talked about the lack of good communication. The department would have to implement targeted outreach for seniors who would be eligible for SNAP. We've talked about not everybody, not everyone's online. So even if you do outreach online, not everybody is there. if you distribute flyers, where are you distributing them? If you're not a non-English speaking person, what kind of translation capability is there? How are we reaching people? How are we reaching people who don't get out, who are homebound? So this legislation would require the department to work to develop targeted outreach. Samantha, advance, please. Also, I talked a little bit about the Office of the State Superintendent of Education. Right now, there is a federal program, it's called the Child and Adult Care Food Program, that will reimburse nonprofits that are offering daycare services, whether it's for adults or senior, for children or adults. Currently, only one adult daycare center in DC is enrolled in this federal program. OSSE, the Office of the State Superintendent of Education, administers this program. So this legislation will say, okay, you, OSSE, have to identify every eligible adult daycare center and then help them enroll into in this program. Again, I think of these things as low-hanging fruit. These are the kinds of things that we as a government should be doing anyway. And we will, through this legislation, I think there will be the support to think about, how is this going to happen? What kinds of things do we as a government need to implement to make it easier? How can the nonprofit community or profit community be of assistance in these efforts? Please advance. And then the last sort of major provision of this bill is, and without getting too in the weeds and bore people to tears, as you know, Medicaid is a federal program for those people who are limited with income. Now, there are, I'm gonna ask whomever is talking if they would mute themselves. That would be great. Cool, thanks. As part of the Medicaid program, there are various waivers. What that means is every state that has a Medicaid contract, there are amendments to the federal Medicaid program that a state can apply for. And what we're saying is that in DC, home delivered meals, nutrition supplements, and medical nutrition therapy, we should apply for waivers under the Medicaid contract to allow those services to be covered by Medicaid. And, you know, we are one of only 10 states that aren't taking advantage of the waiver. So this legislation says, government, let's take the low-hanging fruit. Let's take those things that are available to us, figure out how to implement those, how to apply for them, how to leverage federal funds where we can, or federal programming to provide more services. Let's communicate with seniors about services that are available to them. And then let's, as a city, government, nonprofit, seniors themselves, put our arms around this program and come up with a strategic plan, basically, to address senior food insecurity and advise the mayor on things that need to occur to provide more nutritious food for seniors. Next slide. So where are we now? We are at a point where, as I said at the front end, this legislation has been referred to the Committee on Housing and Executive Administration. How the council works is that a bill is introduced, it is referred once it's introduced into the full council, it gets to refer to a committee so that the committee can look at it, and in theory, hold a public hearing, and then mark up that bill. Basically, take the information from the public, take the information that the council committee learns, and comes up with a better version of the bill. Or if it's a perfect bill, then submit that bill back into the council for approval. Once a bill has been, excuse me, once some legislation has been referred to committee, the chair of that committee has the sole authority to call a public hearing. So now that we've got this bill introduced, the next step and where we are in this moment is to ask Councilmember Anita Bonds to schedule a public hearing. It is an important part of the process which will allow you, government agencies, nonprofit community, seniors themselves to say, this is what I think about this bill, for good or for bad. These are the things that I think would make this bill better. And these are the things that I think that the bill is missing. And particularly for seniors who are food insecure, seniors who are struggling, seniors who, particularly in the SNAP world, seniors who are having difficulty finding nutritious food, to be able to tell their story. So in order to be able to tell the story, to be able to listen, have the council people listen and hear, improvements, how difficult things are for folks, we've got to have a public hearing. So I'm asking you and anyone who has an interest in this issue of providing nutritious food for seniors, making it easier for seniors to access that food, and for us as a city to ensure that there are no hungry seniors in our town, call Councilmember Bonds, 202-724-8198, or send her an email at housing@dccouncil.us, or to her directly at abonds@dccouncil.us. And it's just, this ask is really very simple. My name is Winnie Huston. I live in Ward 4. Please schedule a hearing on the No Senior Hungry legislation. This is not, and the part of what's the beauty, I think, and Samantha, if you would, you can leave this up, but I want to be able to look at people and talk with folks about sort of where we are at this point. No matter how you feel about this bill, it's important for the process. It's important as Americans, it's as important as residents of this town to take the opportunity to weigh in, to say, I don't understand, this part of the bill, or I think things need to be strengthened, or even just to say, how is it that we got to this place? How is it that in the nation's capital, in the richest country in America, we have so many hungry seniors? So I ask each of you, to think very seriously about just giving a call. Ask Councilmember Bonds to hold the hearing. Let's talk about this. So I'm going to stop for a second, and if there are questions or things that I can amplify that I glossed over, I would love to do that. And after some questions, I'll talk about the next step after we get the public hearing, because I'm confident that we will, particularly with your help. Yes, Susan, I happen to see you.
Yeah, good to see you too, Winnie. Winnie, you talked about there are some things are missing from the bill, and I'm trying to take notes. My grandson is here, so he may be in the background. Yeah, you can hear him. So I'm going to mute myself. If you want to tell me about what's missing from this bill, it'd be terrific.
Well, what I will say I'll say a couple of things. I think, well, let me say this. One of the things that we heard about during the working groups is that there are transportation services of various types that the city offers, some at low cost, some at no cost, to assist seniors to get to various places. Sometimes it's restricted to medical care, but other programs that folks could access to get to groceries if they wanted. We as a working group decided not to include that in the legislation, the transportation piece. We decided to focus on nutrition, but we all know that transportation can be an integral part of fighting senior food insecurity. So at some point, we as a city need to look at that. We need to look at what we're offering. We need to look at how are we communicating to people about these programs, and make some investments. So I would say transportation is something that should be looked at some point. That's not in the bill. I will also say, and this is a little controversial, but this is Winnie. I think we ought to be looking at the nutritional content of some of the food that we offer in these nutrition programs. But again, that's not something that's going to be in this bill. But it's because we are insistent in this legislation that nutritionists be part of the working group, part of the task force that will be looking at this issue. I'm hopeful that that question about nutritional content will also come up. There are other things I think that you look at some of the timelines in the bill about, when reports are due. There's some, I think, some room to tighten those things. But I will leave that. I will mention those things as things that I think could have been in the bill, but we made a conscious decision to focus on nutrition, to focus, on the smaller, lower hanging fruit, because we are not going to find our way out of this food insecurity issue overnight. And if we don't start somewhere and start small relatively, we will never build to incorporate all the things that we need to be looking at. But those folks who work with seniors every day will absolutely have ideas about things that could be in this bill.
And I see Judy has her hand raised as well.
Hi, Judy.
Hi. Let me put my hand down so you don't get. Don't forget to do that. Listen, thank you so much for this. A bill like this is so long overdue, and it seems like such a solvable problem with all of the resources that we have, coming into the community. I have a question sort of about the process of coming up with with the pieces that you did include. Mm-hmm. Like, for example, you talked about the EPD waiver, right? And the fact that food is not included in that. Now I know, there's like Medicaid is one of the largest expenses in the city, and is that was there a real conversation about, was food left out in order to make room for other things that can't be paid for, through other sources, for example, right? Like anybody who's on the EPD waiver would be eligible for food delivery, through DACL, right? So, you know what I mean? Like, I'm trying to understand.
Let me say this about that. It is, that kind of discussion is an important discussion to have. But if you don't have legislation that is saying you must do it, you won't get to a place where you're looking systemically at what's the best approach. And when you've got so many people, up to 12,000 seniors, roughly, and this is a guesstimate,
Mhm.
who are food insecure. And on a best, and let me just say, this is not an indictment of the government agencies. The Department of Aging and Community Living, they do a bang up job for what they do. Department of Human Services, those people come to work every day and do the best that they can with the services and the resources that they have to provide services. What this bill is looking at and what we as a city must do is get out of our silos and say, we have a massive problem. Systemically, we've got to figure it out. How do we get out of this? So yeah, the Medicaid waiver and looking at home delivered meals and nutrition supplements, Medicaid is a complicated beast. But we can't let the difficult get in the way of feeding and taking care of people who have worked their entire lives and are at a point now where they're in need. We in this city must do better. And even on the best day, the programs that we have, we're not reaching enough people. Even under the best of circumstances, the Department of Human Services, again, they are working incredibly hard. They have this new online program. And for those people who can manipulate the system, yippee, there are still some kinks in it. And I had a conversation with someone last weekend where someone whom I happened to know is in a situation where she had to apply for food stamps for SNAP. And she was, one, embarrassed that she had to do it. When she found out that there was an online system, she was like, okay, I don't have to go down to an office and sort of subject myself to that. She said she was in tears. It was humiliatingly difficult. The process was difficult. The system didn't work. She was on hold. She was trying to talk to someone while, So even on our best day as a government, our systems aren't reaching enough people. We're making it too hard for people who are struggling. And food is something that is so basic, that basic nutrition, it's a building block of everything. Those of us who have been involved with kids or have kids, grandchildren, know how important good nutrition is. If you don't get good nutrition, you can't pay attention in school. If you're not paying attention in school, then you're not getting a good job, or you can fall victim to other things that, we know about. If you're not getting a good job, then you can't afford to have decent housing. If you can't have these, it's a domino. So we know how important nutrition is for kids. It is equally important for seniors. It is, in fact, in some ways, I don't like to rank oppression, but it's equally important. And so we have to have that tough discussion about, okay, if we didn't apply for, this waiver, why not? How is it that we are one of 10 states or jurisdictions? DC has that city-state burden. So how is it that most folks in most jurisdictions have applied for it? And so we've got to have the discussion. And if we don't elevate it, if we don't, so that, it's not something that the Department of
Healthcare finance.
Thank you, healthcare finance. And there's some great folks at healthcare finance are working really hard. But again, it's about it's being a system-wide approach. So yeah, there's room for a discussion around that. If not that, then what? But we know how important home delivered meals are for some people. We know how important nutrition supplements are for folk. So we've got to get our arms around it. And this legislation will require us to start talking about it and figuring it out. Other questions about either what was in the legislation or what isn't in it, or how people feel about, well, maybe I'll just ask the question, how do people feel about this legislation? Or how do people feel about the question around senior food insecurity?
I see a hand up.
Yeah, I see a hand. Anne?
Thank you very much for a really good presentation. I think you've absolutely hit the nail on the head. Let me just say from personal experience, which many of us have had in our lives and almost nobody admits, applying for food stamps, as it used to be called, is one of the most humiliating experiences when you have worked all your life and you find yourself applying for food stamps, which you view as absolutely the lowest. Applying for unemployment is nothing compared to applying for food stamps. And so I think you really have made quite a case. My suggestion, in addition, I've just been doing it. Sorry, I haven't been paying full attention. But
No.
my suggestion, in addition to emailing Anita Bonds, who I would think would be totally on board with this, would also be for each person to email their own city council person. Mine is Mary Che, and also to email Phil Mendelson, chairman, who is personally on board with these kinds of things. And I think that Chairman Mendelson needs to hear from us also.
I would encourage, thank you for that. I encourage people to, exercise their right, their franchise. Councilmember Che has been a fierce warrior. She gave staff time. Her legislative council, convened this working group, was at every meeting and came up with what you see before you in terms of this bill. Councilmember Che is our champion with respect to food insecurity, not just for seniors, but across the board, across the city. And there were 8 council members who co-introduced this legislation. So I think that there are, most council members would be in support of us making a change. Yes, there will be a fiscal impact. Yes, it's going to cost some amount of money. It may require us looking at things differently. And that's all part of the process. So let's talk about that. But we as a city must put our foot down and say, we're going to do something. We're going to start. We're going to have these tough conversations. We are going to look at our priorities.
Well, can I just mention something along those lines? Because I think that yes, it's going to cost money, but really there's no excuse for not applying for Medicaid waivers, because you need to get the waiver in order to have the program. And so there's some things that are just are predicates that really need to be done. The other thing is that the coordination that you've laid out is not something that costs money. It is something that saves money. So I'm not acting as if the implementation of the Medicaid waivers would be equal to the amount of money saved by better coordination, but we can at least save the money by better coordination and apply it to the Medicaid waivers.
There are many things I believe that we as a city could be doing to address the problem. We have to take small steps. We are not going to, snap our fingers and get out of this. We have a mountain to climb. But we can look at our systems and again, I think of this legislation as low-hanging fruit. There are many pieces of it that are low-hanging fruit. There are pieces of it that will require us to zig where we've been used to zagging. But the important pieces, it will require us as a city to coordinate. We need to get a lay of the land. If nothing else, we need to know, hey, Phyllis, we need to know where the seniors are that are food insecure. We need to know what services seniors are actually accessing. We need to know the ones who aren't accessing services. Hello there, young person. Why not? We need to know how to be more helpful to folk to apply for the process.
She's happy.
Phyllis, you have a question?
I'm gonna pour this away. I'm gonna put it-
Yes.
Sorry, I was listening on the phone the whole time and having to deal with something else, but you know, I'm just as passionate as all of you. And the thing that I think we all know, though, it's going to take collaborative effort. We need a committee, we need government, we need for-profit, we need nonprofit. And because what you're looking at is we will save, but there will be consolidations. If you finally find systems and really get a high-level system that is coordinated throughout the whole city, and we know that's not happening, so you have redundancy so many places, and then you have nothing. And these systems they're creating are so complex that not normal people can use them. So it's multi-levels, but I think overall, if a committee can be established of senior executives in all capacity to solve these problems, you will see savings over time. And we will finally be able to touch everyone, because again, you have to have a sophisticated system to find everybody, but then it's got to be user friendly so that people can, so it is a very, it'll take time. It'll take time.
So, I know we're at time, but I want to say that the process is one that we can all use. Let's exercise our franchise. Let's ask for a public hearing. Let's talk about this bill. Let's talk about things that could be improved. Let's think about things that aren't in it. But let's talk about it, because if we don't start talking about it, if we don't start making a change, I am infuriated. It's hard for me sometimes to even think about, folks who are struggling. It could be me, it could be you. And this is a process, this asking for a public hearing. Once we get a hearing, I would encourage people to think about telling their story or testifying at that hearing. The last slide is that gives the DC Greens website. It is www.dcgreens.org. Right now, if you click on our website, it will pop up, No Senior Hungry. It'll give you the legislation, it'll give you an overview, it'll give you a couple of flyers. It'll give you information about how you can ask for the hearing. And once we get a hearing, and I'm convinced that we will, with your help, asking Councilmember Bonds or contacting, and I stress Councilmember Bonds because she is the chair of the committee who would hold the hearing. It's great to reach out to your individual council member, but Councilmember Bonds is the one who has the authority to hold that hearing, to call for that hearing. So once she does that, and once we get a hearing date, stay in touch with DC Greens on our website, because as soon as we get a hearing date, it's going to be on our website. We will be holding, providing information about how you sign up to testify. We'll convene either through in an advocacy capacity, or the DC Food Policy Council will convene sessions to talk about how you negotiate the process to testify at a hearing, give you more information about the bill. So please, I encourage you to exercise your franchise. Ask your friends and neighbors to make the call, to send the email. Thank you so much for taking the time to listen to me. Your neighbors are depending on you. This is important.
Yes, thank you, Vinnie. Yes, thank you very much. We will continue to spread the word. I'm already drafting a message to Anita Bonds and Charles Allen in my own mind and on my own computer.
Yes.
And I think I expect many of my fellow village members will be doing the same. And let's keep in touch.
Please.
And, work towards it.
Yeah.
Please, I put my email in the, I'll put it in the chat as well. It's on the presentation. anyone who wants the presentation, you know, Joanna, Samantha, if you could share it with people, that would be really
Yeah.
helpful.
Yeah,
And let me apologize in advance. I put that presentation together alone. I am a senior who's not always, so it's not fancy, but the information,
it's good.
some of
And
the
informational.
fonts are a little funky. But so I do apologize for that, but the information is there.
Yeah, it gets the point across, and that's great. Also, I'm already thinking about how to share those flyers. So we'll be internally here talking about it. And I know that we have a few in the audience from other villages. So, and I know Judy Berman, our executive director, has been spreading the word even today, this morning. So I think we'll be working with other villages and everybody. I think it's a cause that's definitely worth working for.
Well, thank you again for your
Thank
interest
you.
Thank
and your
you.
time. Have a great holiday season. If I don't talk to you all before, and Happy New Year. But certainly, as I said, stay in touch with the DC Greens website, because as soon as we hear about a hearing, it'll be posted. And you may very well see me come back to talk about, you know, the hearing or to share an
Yeah.
advocacy guide or the like.
And I
And my
highly
pleasure.
recommend, looking at the website, because DC Greens is doing great stuff, really interesting.
We're not doing it alone. There are lots of
I know,
people out
yeah,
there who are,
absolutely.
you know, who are spreading the word. Joanna just happened to hear me and she invited me, but there are others out there who are spreading the word as well. So thank you all. Happy New Year.
Happy
And,
holidays.
Happy
Happy
New Year.
holidays. Take care.
Thank you, Winnie.
My pleasure.
What are you doing?
Okay.
Thank you, thank you.
Bye, everyone.
Bye, everyone.
Bye.